Hello and welcome to IBD School. My name is Peter Higgins. I'm a physician and researcher at the University of Michigan. In this video, IBD School 809, we'll talk about the risk of inheriting IBD. It has been proven that IBD runs in families, and some more strongly than others. However, about 95% of people with IBD do not have a first-degree relative, meaning a parent or a sibling, who also has inflammatory bowel disease. There are many genes associated with Crohn's disease and ulcerative colitis, over 180 genes and counting as of 2016. However, each of these genes is very weakly associated with IBD. Most people who have these weak alterations in genes linked to IBD will never actually develop inflammatory bowel disease. The risk of IBD seems to come from a combination of genetic risk and the risk of something else in someone's environment that triggers IBD. These genetic risks can be different in different ethnic backgrounds in different parts of the world. For example, one gene, NOD2, is the highest risk gene in North American and European populations, but it's not associated with inflammatory bowel disease in Asia. We know from epidemiologic studies that the risk of IBD goes up with environmental factors like the use of antibiotics, the use of nonsteroidal medications, living in a Western society and whatever goes with that, consumption of meat, and with eating a fast food diet. In a well-done 2015 study from Denmark, Tina Jess and her colleagues measured the risk of IBD in first, second, and third-degree relatives in Denmark. We know the baseline risk of IBD in populations is about 1 in 250 people, although this gets lower as you get closer to the equator, perhaps due to more sun exposure, levels of vitamin D, or other factors. Based on that paper, the risk of inheriting IBD from a first-degree relative, like a parent, is about 8 times higher for Crohn's, about a 3% chance, and about 4 times higher, a 1.5% chance for ulcerative colitis, compared to anybody else in the population without a parent with IBD. So if you are a parent concerned for your child, the chances are 97% for Crohn's and 98.5% for ulcerative colitis that they will never have IBD. Certain families are exceptional, where there are multiple family members with IBD or other autoimmune diseases like lupus, rheumatoid arthritis, or psoriasis. In these families, the risk of IBD can be significantly higher. Similarly, the risk of a twin of someone with Crohn's disease is about 50 times higher than the baseline population, or about 20%. For ulcerative colitis, the twin risk is about 11 times higher, or about 4.4%. The risks of inheriting IBD are even lower if someone only has a second-degree relative, like an uncle or grandparent who has IBD. The risk in a second-degree relative is 2.4 times higher than an average person for Crohn's and 1.8 times higher than an average person for ulcerative colitis. And consequently, the risks are even lower, 1.9 times baseline in Crohn's, 1.5 times baseline in ulcerative colitis if you have a third-degree relative like a cousin or great-grandparent who has IBD, and you're worried about developing IBD. The good news is that the risks of inheriting IBD are actually quite low. Most children of people with IBD will never develop IBD. It is important to ask your doctor about the risks involved before you or your partner decide to get pregnant. Many people with IBD avoid pregnancy based on a false assumption that there is a high risk of IBD inheritance, which is rarely true. The effects of the medications you take before or during pregnancy will be covered later in IBD School 802. The most common reason to wait to get pregnant in IBD patients is having active inflammation. It is much more difficult to have a successful pregnancy or to take care of children if you are dealing with active inflammation. Additionally, women who have had pelvic surgery like the creation of a J pouch, are more likely to have scarring that affects their fallopian tubes and may need in vitro fertilization or IVF to become pregnant. This is explained in IBD School video 802. Many parents ask if there is anything they can do to protect their children from IBD. Studies from New Zealand and Denmark have identified protective factors that reduce a child's risk of developing IBD, which include having pets, being breastfed for more than 6 months, having a tonsillectomy, having a vegetable garden, and having high exposure to dietary fiber and low exposure to sugar in the diet during childhood. It appears to be important that a child's immune system is exposed to the environment around them, including bacteria, viruses, dirt, and pets. Studies have shown that this helps to train the immune system not to overreact to these bacteria commonly present in everyday life. We often recommend eliminating antibacterial products from the home, like hand sanitizers, and avoiding constantly disinfecting your child. It may also be helpful to breastfeed and to avoid excess sugar in a child's diet. These are important exposures in training their immune system to stay in check. I'm Peter Higgins, and thank you for watching IBD School.